Welcome to Integrative Medicine with Dr. Leland Stillman, the podcast where we explore the best of East and West, old and new, conventional and unconventional, in search of answers to medicine's toughest cases and most difficult problems. This podcast is for informational purposes only. Diagnostics and therapeutics discussed on this podcast may or may not be right for you. So talk to a qualified practitioner before taking action based on what you learn here. If you'd like to become a patient at my practice, go to stillmanmd.com to schedule a complimentary discovery call. Thank you for listening and welcome to today's episode. Good morning, everyone. Dr. Stillman back for another Q&A. Thank you as always for your questions. Premium subscribers to Substack and practice members get to ask questions as priority. If you'd like to have your question answered, upgrade today, and I'll be happy to do so. As always, this is general education, not medical advice. Always work with a qualified healthcare practitioner before making any changes to your diet, lifestyle, supplements, or medical care. And without further ado, let's jump in. Okay, first question from Becca. What are your thoughts on using a DHEA supplement when trying to conceive? Would the form of DHEA matter? Liposomal, microsomal, etc. Okay, so overall, my approach to hormones in pregnancy is that rarely have I seen more. What do I mean by that? Here's a classic example. A woman comes to me. I notice her free T3 is borderline low. Her TSH is normal. Her other thyroid labs are unremarkable. I give her thyroid hormone. Her cycles normalize. She becomes pregnant. That happened last year to a woman who'd gone through IVF, I think, multiple times for her first pregnancy. And then her second pregnancy, frankly, we can give the credit to Armour Thyroid. Okay. DHEA is a sex steroid hormone. In women, it can cut both ways. So DHEA in women with PCOS, it will be pathologically elevated. You don't need to give them more, and you shouldn't give them more. I've also had women in the practice have these sort of idiosyncratic reactions to DHEA. It is an androgen. And so I target a level of about 250 based on the LabCorp reference range for women in general. But women can get too much. And I've had a few women say, I just don't tolerate this. Very unusual. Men, not so much. Why that is, I'll get back to you when I figure it out. But my point in pregnancy would be, I would be inclined to use it because I would assume that it would support other sex steroid hormone levels. That being said, of course, I would always defer to an obstetrician or midwife who's perhaps better trained in that area. I will say that the obstetricians, I don't share the same philosophy towards hormones with them. They have totally different training and understanding of that than I do. Basically, what I do is I look at, okay, what are our targets for hormones? How can we support the hormones naturally? And then how can we supplement them as needed? And DHEA is not one I've specifically studied in pregnancy. I'm more familiar with it for anti-aging. Does the form matter? Okay, so I haven't worried about the form, and I haven't seen the form matter when it came to testing. So I just take off-the-shelf DHEA. I'm currently using Designs for Health. That may change. I've used Quicksilver. I've had patients use Pure. I've had patients use Douglas Labs. I haven't had a clear trend on what works and what does not work. But when I find it, I will let you all know. Copper sulfate in organic crops. So this is also from Becca. I've heard you speak about copper sulfate exposure through pesticides, particularly in organic crops. Could you speak more about how you first learned about this, sources, articles, mentors, in determining which foods have the highest risk for exposure and what's foods to avoid or limit? Do you have any shocking trivia about copper sulfate? It's almost like you've heard this from me before, Becca, and you're just looking for me to put it out on a Q&A, so I will humor you. Okay, so copper sulfate, for those of you who don't know, is a organic pesticide. What that means is that it is a pesticide. It will kill pests. It will kill fungus. That is approved for use in organic crops because it is technically an organic or natural product. However, copper sulfate is inorganic copper. Your body can't use inorganic copper the way it can use organic copper, which means copper that's been complexed or linked or bound in, say, carbon structures. What that practically means is that copper that you get from a food like oysters or beef liver or nuts or seeds or root vegetables, which are all great sources of copper, or green leafy vegetables, is going to be handled by your body differently than copper that's coming in from, say, copper piping that's leaching into your water. Where this comes out in our practice is that we'll often see patients having these very elevated levels of hair copper as they're getting better and they're feeling better. We assume this is the body detoxifying itself from copper in the hair. They'll often have normal or low blood copper levels at that time. Interestingly, well, I'm not going to geek out about the labs here just for the sake of time, but basically we know that this inorganic copper is getting into the body, it's being stored in the body. It does have toxic effects and you need to limit your exposures to it. What I found when I looked into the data on this is that when you do the math for how much copper sulfate is being sprayed per year on planet Earth, there's 60 milligrams being sprayed per person per day, which, to put that in context, if the average person gets 1 milligram a day in their diet, they're spraying 60 times that on our crops every day. Pretty wild. So I think what's happening is that a lot of this copper is it's staying on the food or it's being incorporated into the food and then people are consuming it. And I think that's one of the reasons why people are having so much trouble in our modern world with fruit, because fruit is something that is very heavily treated with copper sulfate. I can't prove that. It's just a hypothesis. I'm very curious about it. So we'll often have people limit these high copper potential foods, and mostly it's fruits. I don't know about vegetables, haven't really looked into that. It's mostly I'm aware of being sprayed on fruits. So hopefully that is helpful. All right, lowering thyroid antibodies. Could you share a bit about patients you've worked with who have lowered their thyroid antibodies or have failed to? What patterns do you see leading to recovery or blocking recovery? How much do you as a clinician care about thyroid antibodies trending to below lab reference ranges, and what is a reasonable time frame to expect this to happen? Okay, so I don't trend these, and because I don't trend them, I don't see patients resolving them. I suppose that I could, but on the other hand, you'll find that lots of patients who are asymptomatic and feel well do have thyroid autoantibody levels that are detectable. I think the question is really, what do thyroid autoantibodies actually mean? And I'm not really sure that anybody knows. What we see is that people who have certain diseases may also have elevated thyroid autoantibodies. We do not necessarily see that people who have thyroid autoantibodies have diseases or other detectable signs of illness or injury. Do I think that the lab reference ranges may not be reasonable? I do. I do think they may not be reasonable. I think they may need a revision, either up. Maybe I'm wrong. Maybe they need to be revised down. But because I haven't trended them, I haven't seen this. What I will say is that there's a strong trend when we fix minerals and vitamins and macronutrients and diet and lifestyle over a long enough period of time, we see patients becoming less and less dependent upon thyroid support. So I'll give you an example. This is a real case from the practice. This woman came in on no thyroid hormone, started supplements, minerals, vitamins, our custom protocols based on her lab testing. She saw rapid progress, felt much, much better, achieved her clinical goals, continued with us to optimize. She decided to start bioidentical hormones since she was in perimenopause. She was delighted with the results from those. We added thyroid hormone because we felt that that was perhaps a missing piece of the puzzle to her optimal state of health. She rapidly lost weight, was delighted. Then we didn't taper it fast enough, and she ended up having some panic attacks and anxiety. She cut the thyroid hormone out, and all of that resolved. And the funny thing about that is her thyroid hormone levels are better than ever now off the thyroid hormone after about 2 years of the right vitamins and minerals based on her unique labs. So that's obviously an individual result. I can't guarantee that for anybody, but there's a very strong trend in the practice for patients to become less and less dependent upon thyroid hormone. This requires a high degree of compliance and implementation of the full framework and protocol with regular scheduled follow-ups, and many things will derail that. Stress, life events, you name it. So that's been my experience so far. There's some things we see that have a greater impact on thyroid function and antibodies and autoantibodies than others. Things like iodine, for example. If people are curious to read the high-dose iodine protocol, I cover more on that there, and I give a case study with a before and after lab value. So hopefully that's helped. Cookware recommendations from Michael. What cookware do you recommend? Specifically, some people are against cast iron and non-stick green pans. Is stainless steel and cast iron enamel the best options? So indeed, I would say stainless steel, cast iron, and then cast iron with enamel are your best options across the board. I do use the green pans. I'm not familiar with any substantive criticism of them, although I'm open to learning. If you want to send me what you're referring to, I'd actually be happy to look at it because you've piqued my curiosity. That's the cookware I rely on. And I hasten to add, actually, glass. So we cook in a lot of Pyrex in our home. All right, oligoscan versus HTMA. I'm wondering if you have any strong reasons for not using the oligoscan instead of or in addition to the HTMA and other testing such as urine or blood. It's quicker and could be used as a point of care test, which can have substantial benefit. I think the interpretation would rely on pattern recognition more than exact numbers. Yeah, let me talk about oligoscan. I had a great call with one of the folks who runs that company, and it's actually a device that I have long thought would be the optimal way of measuring and determining mineral status. What I haven't had time to do, I haven't invested in the product, and I haven't tested it against other methods of testing. What I'll tell you is that we get great results with HTMA, and we're not hurting for better results. I'd always like to be able to get even better results than we're getting, but I haven't had the time to vet this and figure out how to integrate it into what we do. Could it be superior? Maybe. There is a ton of complexity in how to measure metals and minerals in the body. And so even in a perfect world, I'm not exactly sure how I would vet this exact device, but I'm certainly open to it being a very useful clinical tool. Like I said, just haven't had the opportunity to vet it. Okay, interpreting iron labs. Olivia asks, where can I learn how to read iron labs correctly? So I'm about to launch clinician training again. When I say about, I mean 6 months to a year is probably when we're going to launch that. I'll be teaching people how to read iron labs there. I don't have anywhere I can send you right now. What I can tell you is that I posted the optimal ranges in my repair deficit survey post on Substack. Lots of detail there. I will be coming out with more detail soon. All right, EMF. I heard the Seahawks and Patriots are refusing to practice on the 49ers practice field before the Super Bowl due to the rumors of high levels of magnetic flux. Should I be concerned about EMF exposure? So let's talk about this. If you didn't know, there was a post on social media by a guy, I think his name was Peter Cowan. He's a coach certified by the Institute for Applied Quantum Biology, where I actually teach. And he posted about the massive magnetic fields near the 49ers stadium, which he suggests or proposes explain their very, very high rates of injury. I think he's right. We've known for decades now that high EMF really degrade collagen and therefore undermine the integrity of the body. So it makes sense that you would see more injuries in a team that practiced in a high level of EMF. This has really taken off. And obviously the usual mouthpieces of the establishment have said this is a conspiracy theory. These people are total nut jobs. They deserve to sit somewhere in tinfoil hats and, whatever, ignore them. Those people obviously have no idea what they're talking about. Those are the people, the industry mouthpieces, that is. They're just covering for an industry that we know has a lot of hazards and dangers. Very, very well documented in the literature. If you want to hear my podcast with world expert Ole Johansson, we talked about the science. You want to hear my podcast with a clinician, Laredo Ritter. Dr. Ritter inspects homes for EMF now in Texas. And he's a pediatric neurologist. He's been studying the effects of the EMF on the brain for decades now. So ample proof and more than a few pieces that I've put out in our podcast. So sources of pollution for EMF: cell phones, wireless routers, any kind of household appliance or electronic, smart meters on your homes. These are the big things that I look for people. I try to hardwire everything in my own life. This whole computer, this whole setup is hardwired. There's no wireless signals. There's no wireless keyboard. There's no wireless mouse. There's no wireless microphone. There's no wireless camera. There's no wireless, like remote controls. I'm not even on Wi-Fi with the computer. It's hardlined into an actual router. Your life is not going to be perfect, so I don't expect perfection. I do hope you'll try to make it better and better, because I've been shocked at how much patients find this really helps them in a meaningful way. Little things anyone can do is don't put your phone on your body when you can keep it off. So like keep it in a pocket on the backpack, put it in the console of your car. Even a foot, 6 inches actually does make a difference in terms of your exposure long term. Avoiding working near high EMF things. Like I wouldn't work next to a refrigerator. I wouldn't work next to a deep freezer. I wouldn't work next to a smart meter. I would never sleep next to a smart meter. Smart meters are a disaster. The closest I think I would ever consider sleeping to one on a regular basis is about 30 feet. And I would feel a little nervous at 30 feet. 40 or 50, I feel a lot better. That may not be possible. I think we're probably okay at around 20 maybe, but I just have had too many people living or sleeping or working in the room next to the smart meter, or the office or the bedroom, really come down with really crippling illness to feel comfortable with that myself. And by the way, you can go to your electric company and say, I want my smart meter disabled and I want to go back to the old meter type. and they will have someone come out and check the meter like they used to. Anyway, bottom line, should you worry about EMF exposure and what could you do about it? I gave you some quick tips. I also recommend people look at the 14-day reset. That 14-day reset's where I start all my patients. It gives them the minerals, the hydration, the sunlight, all the things that help them initially to mitigate the stress and damage being induced by EMF exposure. All right, albumin target levels. Michael says, you mentioned tracking albumin as a target for optimal health. What level should we be targeting? So I don't have a hard floor on this. And I say floor because I've seen people in the practice come in the low 4s to the upper 4s to the low 5s. I've noticed that a lot of the healthiest patients in the practice have an albumin of 5, 5.1, 5.2, certainly in the upper 4s. I accept any albumin down to about 4. Below that, I'm worried that the person has underlying disease that's impairing albumin production or consuming it, so they're actually losing albumin. I really feel better as it trends up more to the high 4s, low 5s. Okay, GI cocktail. Michael asks, years ago you put out a GI cocktail. Do you still recommend the same formula? What's the dosing or amount that you recommend? Yes, the GI cocktail I still recommend. However, I found that the DIY protocols were sometimes a bit beyond people. I get it. You got to go to the place and buy the stuff and ship it. And then do I take it cold? Do I take it in water? Do I take it with food? It tastes weird. Totally get all that. I ended up creating, and we now stock a GI Restore product in the online store, store.stillmanmd. You can get that product, and it's basically this GI cocktail. It's one of the best things I've ever found with patients with gut issues. So it's blown my mind how effective it is. The GI cocktail was based on a review of that product and other products that I saw out there in the world, people using, getting and reporting really great results. The GI cocktail post on Substack is more of a breakdown, like behind the scenes. Here's what goes in, here's why. The product I stock on our store at StillmanMD, store.stillmanmd.com, is just, here's a simple, buy it right now. Don't have to go hunt for ingredients option. All right. Indoor air quality question from Michael. What are your thoughts on indoor air quality? How important is it to decrease toxin load? What can be done to improve it, especially high VOCs? So first of all is living in a low air pollution area. So you'll just see this across the board. The people who live in the highest air pollution environments are going to have the worst toxic burden. And the people who live in lower or higher quality areas are going to have much lower toxic burden. They're going to do much better clinically. Very subtle, insidious effect, but I just guarantee you the people in Chicago, New York, LA, Atlanta, various other major cities, that you just see them having a much tougher time getting well. Part of this is the air, some of it may be the water, a lot of it is the EMF, hard to say, but my practical approach is maximize your outdoor air quality first by picking the right place to live. Now, when you've done that, regardless of where you live, indoor air quality, what I like to see is a particle filter, a HEPA filter specifically. That's for the big particulate matter that can put a slow strain on the system and introduce a lot of other things on the particulate, like things like heavy metals, VOCs, petroleum toxins, things like that. Then I like to think about, well, how else are we going to clean the air? Are we going to add like an ionizer or a UV light filter? That has to be done based on the size of the house, because if you add things like, say, UV light filtration and you don't size it correctly to the house, you can actually generate enough ozone to make yourself sick. So I'm not a fan of that. So that's where I would work with someone who's actually a professional. And other than the HEPA filtration systems, I don't currently have a favorite for air filters. Oh, and then for VOCs, simplest thing to do to minimize VOCs is minimize your new stuff. So new furniture, new clothing. I've had some crazy cases, one particularly that I remember of a woman who ran a boutique clothing store and they had terrible ventilation and she had these crazy toxin levels and she just never made progress. It was very tough to watch. And yeah, the only thing I could find in her whole case, having reviewed it many times and talked to her over a period of years, the only thing I could find that explained her difficulty getting well was the fact that she was in this, soup of chemicals every single day for hours and hours. And I tried to help her to change that, but it was not something she ended up changing. So getting your furniture aired out outside, opening the doors and windows. I tend to open doors and windows morning and night, get some fresh air in, get all that pollution out. All right, polycystic kidney disease. This question's from Susan. Is there a protocol you would recommend for polycystic kidney disease? There's not a specific protocol, and obviously this would be disease treatment. But on a general educational level, what would I think about when I saw a patient with polycystic kidney disease? Well, I recall that This illness has what we call, I believe the term is variable penetrance. Or no, it's not penetrance. And I'm forgetting the technical genetics term. But basically, many people will have the gene, but they'll have a variable course, clinical course. So you'll have, say, two brothers, very similar genes. Let's say that they're twins, they have identical genes. But based on their lifestyle choices, one of them will have a worse outcome than the other. They'll have more severe disease earlier. Why is that? It has to do with all these factors that I talk about and write about. It has to be. It has to be about environmental toxins and healthy food and all these other things. Anytime I'm confronted with a genetic issue, I just say, look, let's get everything right that we can, that we know is going to be good for their body, and then we'll see how it affects their genetic problem. And that's really all that we can do. All right. This question's from JL. Lately, I've been dealing with chronic congestion. It's interrupting my sleep. I wake feeling panicky. My nervous system feels very fragile. Breathing programs sound overwhelming. Are they worth it? How do you know when constricted airways are an inflammatory versus a structural issue? Orthodontist said my mid-aged children all have nasal airways about 8 to 10 years behind their age and is advising major palate expansion. What is inflammation? What is structural? Their teeth are clearly crowded. I had the orthodontics decades ago, but airway was never mentioned. Straight teeth was all that mattered. We're trying to discern the simplest, most economical, yet long-term best path forward for all of us. Thank you so much. Take care. Thank you, JL. So first of all, I can't practice medicine via Q&A, but I can give you, a big picture educational view, right? So whenever I hear chronic congestion and panic and nervous system feeling fragile, think about indoor air pollutants and specifically mold, because a significant proportion of these folks, you'll find they've got mold somewhere in the building where they're living or working. And when you eliminate that, a lot of the things get better. And if you don't eliminate it, rarely do people actually do well. Mold is a terrible, terrible hobgoblin. I'm going to call it a hobgoblin of integrative medicine. It really just kneecaps patients and ruins their lives. So you got to find the mold if there's mold. Next piece of this. Sometimes chronic congestion is actually food or environmental allergies, which we can diagnose and treat in an appropriate medical context. We use a variety of different things for this, and we have, I would say, pretty good results, although it's not something we specifically specialize in. A lot of patients come to us with this, not for this, and we do sometimes see them get great results. Should you do a breathing program? The breathing program and breathwork that I recommend across the board to patients comes out of a school called the Buteyko method. It's not overwhelming. It's pretty simple. I really like it. It's perfect for this kind of picture. So I can't prescribe it to you or recommend it to you, but you can go research it and figure out if it's a good fit for you. I don't think it should be overwhelming. I find that a lot of the breathwork programs out there are sort of more for like the biohacker, self-quantifier who wants to, be super whatever. And if you're into that, awesome, cool. But for the people who are overwhelmed, panicky, struggling with their breath, their nervous system, a lot of those programs are actually going to push them in exactly the wrong direction. So I like Buteyko method breathing and protocols for those folks. All right. Now, as far as like airway, sinus congestion, nasal breathing, children and things like that, this is really tough. I've been through this myself because I have a very narrow upper jaw. My dentist, Tom, who was my best man at my wedding, I have the dubious distinction of being like the worst case he's ever seen. Super fun for me. So I speak from an abundance of personal experience, more than direct clinical experience, because this is not my wheelhouse. Basically, the most important thing is to get kids to breastfeed. And then I really think that the way society's gone, where it's like baby food and this and that, I mean, like traditional cultures didn't do that. I don't know exactly what they did because I'm not a pediatrician, but I really think that you should look into how can we have the kids breastfeed for as long as possible, and then what did traditional societies do that supported optimal airway health and so on and so forth. All the things that I talk about and write about, minimizing toxins, stresses, optimizing health, nutrition, all that will play into how well does the child develop? Do they get allergies that then create sinus congestion, that then create mouth breathing? All of that really matters. So all the fundamentals I talk about, I think are important here for people who are not clear on that. And then what do we do about, okay, we're 20, 30, 40 years old. My favorite thing to do in dentistry, particularly when a very expensive course of therapy is recommended, is just get a second opinion, because sometimes dentists will A, not agree, and B, you'll find a better option. That would be, I think, certainly that's what I advise my patients to do. And I don't see how you can lose that way. I've had some crazy personal stories of people saying, well, you need $20,000 or $30,000 worth of work. I go to another dentist and they say, no, that doesn't make sense. This is more $4,000, $5,000, $8,000. So there's a lot of unscrupulous dentists. I'll just leave it at that. And I hope that's helpful. It's tough to give me, I can't give you obviously personal guidance like you might want. Okay, iron in pregnancy. So when iron levels are low in pregnancy, what do you suggest to optimize them? So in general, I defer always to the obstetrician and the midwife, but what I've seen work and what I've heard them recommend is they've got various different supplements that are rich in iron. The midwives tend more to this than the OBs, who will, I think, in general, rely more on ferrous sulfate, which is a prescription nutritional supplement that's very poorly tolerated. People feel awful on ferrous sulfate. I think the midwives probably have better products in general. I don't have one. I don't have a favorite in this race. In general, when I'm thinking about nourishing women who are planning to or attempting to get pregnant, I want them eating a really wide range of very nutrient-dense foods: nuts, seeds, root vegetables, some grains, pseudograins if they tolerate them, lean meats, vegetables, fish, not necessarily shellfish, but if they like them, tolerate them, they can be perfectly fine for them. And so long as women eat enough variety of these different food groups, they tend to not need a lot of mineral supplementation. It's when some of these more nutrient-dense forms of food are eliminated from the diet that women will often run into their worst nutritional deficiencies. So I'm talking about deficiencies of, say, copper, zinc, iron, trace elements like manganese, let alone the B vitamins or magnesium or potassium or sodium. So that's my general approach to that. And that question was from Lee. Rewiring a hypersensitive nervous system. A friend and I both have issues with being hypersensitive in our nervous system after dealing with mold. We can't seem to avoid getting overstimulated and stressed out. For me, that leads quickly to depression and low mood. What's the simplest way to rewire the nervous system to resiliency and safety again? Okay, so I'm going to go back to the breathwork answer I gave earlier. It's a game changer. I love the breath work we do. This question, by the way, is from Jess. Hello, Jess. The other thing that I will do is we have a mold toxicity protocol. We based it on Neil Nathan's work. If you don't know who he is, he's one of the, I think, the top MDs in the world for mold. And I interviewed him. I think that interview has been published on the podcast. If you're curious, read it or listen to it. It's a great podcast. We go over how we handle and tackle mold. The breathwork's one of my favorite things for this. I've also seen the LifeWave patches Aeon work well for this, and X39. My friend Ashley also, she and I recorded a great podcast episode about her journey with mold. That was part 3 of our 3-part podcast series. I encourage you to listen to that. She drops a lot of knowledge and information about how to recover from that. I know that with what we do, we always get mold cases in the practice, and our system works very well for getting those people well. I think it's much more efficient than a lot of other systems I've seen. We have a lower pill burden. I think we have a more foundational approach. I really like what we do for folks with mold issues. Urolithin supplements. What's your opinion on urolithin A? Is it something we might want to add to our daily protocols? This is from Treva. So Treva, I'm sorry, I actually haven't had time to look into urolithin A in detail. It's sort of one of those things on my list. And when I do have time for it, I promise I will answer your question in more detail and with more thought. But I did want to let you know I don't have a strong opinion on it right now. Vitamin C in pregnancy. How do you adjust your vitamin C protocol for pregnancy, if at all? Are there any risks with high dosages? This is from LK. That I know of, there are no risks with high dosages. Vitamin C is safe, arguably in any dose, so long as it's appropriately buffered and reduced. Poor quality vitamin C is really where I think the issue is with vitamin C dosing. I wouldn't use the high dose vitamin C protocol in a woman who is pregnant for multiple reasons, but top 2 would be, number 1, it tends to give people, by design, the way it's written, it gives people loose stools. It's hard for pregnant women to get up and off the toilet. It just seems like inconsiderate of me, so I wouldn't do that. And then the second is women often in pregnancy struggle with hemorrhoids. So if they've got hemorrhoids, the vitamin C protocol, because it induces loose stools, could create worsening of those and pain and discomfort and bleeding. So we don't want to do that. I would just use a low dose that's easily tolerated by the patient. There's no toxicity in vitamin C during pregnancy. In fact, it's necessary for growth and development and health of the fetus. I would just use a low, well-tolerated dose. So thank you all for your questions. Thank you to premium subscribers and practice members. Allow us to make this kind of content to educate more people. You obviously, or maybe it's not obvious, you may not know, you get a discount at the supplement store. It's 25%. It's a really deep discount. You get an email every month. And if you're a premium subscriber to Substack, you get a link in every email that you get that takes you to a post where you'll find your discount code. So please enjoy that benefit of premium subscription to Substack or membership in the practice. So if you're curious to learn more about what we do and how we do it, I recommend you check out the 14-day reset. This is the same protocol we start every patient on at the practice. You can find the 14-day reset at stillmanmd.link/reset. Until next time, everyone, be well.